The nationwide flu outbreak is showing no sign of easing up. So far this season, more than 14,000 people across the country went to the hospital for flu-related symptoms, and at least 53 children have died, including 3 from Ohio. We're now at week 10. Flu seasons typically range from 11 to 20 weeks. This year's epidemic could last until May. And there are now growing concerns about a medicine widely used to treat the flu.
Right. Parents all across the country are reporting their children started hallucinating after taking Tamiflu. One family is even blaming their son's suicide on the medication. But is this cause for panic?
Tamiflu, like any medication, has potential side effects.
Among them, neuropsychiatric side effects.
It's not always actually clear whether it's the medication itself or the virus, because influenza can cause something called encephalitis, which is inflammation of the brain, which can lead to some of the same symptoms, hallucinations, confusion, altered mental status, that sort of thing.
A family in Indiana says their daughter was hearing voices and saw bugs on her body after starting Tamiflu. In Texas, a couple says their 6-year-old daughter tried to jump out her bedroom window while on Tamiflu.
She was about to jump out the window when my wife came up and grabbed her.
And less than 24 hours after starting Tamiflu,
had I known that this was an issue, I would have never given it to him.
This Indiana teen committed suicide. His parents are adamant the medication is to blame.
We are seeing the side effect more this year than we've seen it in previous years, but that's just because the total number of kids taking the medication has gone up, not because there's something wrong with the medicine itself.
Dr. Amy Edwards with University Hospitals Rainbow Babies and Children's Hospital says such dramatic side effects are extremely rare.
For the parents who are insisting that their kid get Tamiflu because of how scared they are about the pediatric deaths we've had, if your kid is not high risk, then you do need to think about the fact that this drug does come with side effects.
But if your child is high risk, meaning under the age of 2, or has health issues like diabetes or asthma, Tamiflu might be their best option. And if you notice anything alarming, see your doctor right away. Again, psychiatric side effects are a known side effect of Tamiflu, but they're extremely rare. Dr. Edwards says it happens in less than 1% of pediatric patients. Evidence also shows that Tamiflu is only really helpful if you've been sick for less than 48 hours.